Strattera is the first and only non-stimulant prescription medication approved by the U.S. Food and Drug Administration for the treatment of attention deficit disorder in adults. Strattera is part of a total treatment program. Important safety information will be presented at the end of this video. The following stories tell the experiences of patients receiving Strattera to help manage their ADD symptoms. These experiences are specific to these patients, and individual results may vary.
When I would think about what was going on with Joe, sometimes it was just, well, that's just Joe. He just gets like that. I mean, I always felt like I knew that he loved me a lot, but I wasn't really sure what was going on and like how would we work through what was going on.
The ADD, ADHD put a lot of pressure on our marriage right in the beginning.
There was definitely a ton of disorganization, constant forgetfulness.
I've been doing this since I was a little kid. When I was younger, I would just be, scattered all over the place.
He couldn't really explain it, what was going on for him.
I would have projects started, in the basement, in the living room, in the garage. Nothing was getting completed.
Getting done. And then that's so frustrating, just looking around and seeing all these not completed tasks.
Well, Robin and I, we had discussed starting a family, and she was very reluctant in going there because she just didn't think I could handle, a crying baby, just a little person in our lives. To throw that on top of my scatteredness and frustration and, forgetfulness and just being all over the place, she was not really looking forward to having to raise a baby by herself, more or less, and then trying to keep me in line too.
Here I am at medical school. I am sitting amongst some of the most intelligent students in the country, and I can't pass the exams. I was more easily distracted. I felt incompetent because I thought, here I put all this time into achieving this goal, and it's not going to come true. I'm a failure.
I could tell it was hard for her to come out and talk to me about it, but she finally did, and I was grateful for that. She told me she was having a hard time concentrating and retaining the material for the test.
I've been working on this since high school, so almost an 8-year dream was hanging in the balance of my ability to pass exams.
10 after 8 here on the Guy Kemper radio program.
I had been fired from every single place I've ever worked at except for Cape Canaveral. Some of the pain ADD has caused was because of my impulsiveness, my daydreaming, the not finishing a project. What I did to my children and what I did to my wife was inexcusable. When you're in radio and you get fired, you have to go to another town, another place. And I remember in 6 months, we moved to 10 different cities. My kids would say to me, "Dad, please don't get fired. I like it here." Every one of my bosses, every one of my general managers, anybody that was above me in the chain of command, thought I was difficult to work with, a jerk, hot-tempered, and so forth.
I just assumed it was his ego, so when he went to Florida, I actually said to him, "Guy, just keep your mouth shut, take the paycheck, and quit trying to be a rebel." Yep, you're right, absolutely, and I'm just going to do this, whatever they tell me. If they tell me to just play music the whole time, that's what I'm going to do. Great. Lo and behold, he gets fired again.
I couldn't control my impulses, and the moment anything would happen, I'd feel bad. The moment it happened, I'd walk to my office going, "Why did I say that? Maybe I shouldn't have said that. The guy's a nice guy." You just can't shut your mouth.
I run heavy equipment for a construction company. We're a subcontractor for the power company, power and gas company. So we're working, around live utility lines and all underground utilities. There's big opportunity working with heavy equipment, working around a lot of different people to injure somebody or kill somebody, God forbid. I wasn't concentrating on what was around me. I was just kind of, my brain was wandering, thinking about all kinds of different stuff.
When I was a child, I was very easily distracted, inattentive, and irritable, and wouldn't get things done on time. I'm the type of student that would sit in class and would hear another student tapping their pencil. I'd hear the clock ticking, and that would take away from my focus of being able to listen to what the professor was saying. So that made it very difficult to get the key concepts that I needed to perform well on exams.
I was just so used to being that way. We were both worn out from it, but you know, when I saw it was really taking a toll on Robin, that's when I finally, you know, agreed to go and seek out some help for it.
We can't let our circumstances define us. I mean, the difference between a stumbling block and a stepping stone is how you move your feet. And I chose to take the diagnosis of ADD and run. I had a mission. I left my doctor's office with a prescription and a mission. You know, I didn't, you know, sit down and feel sorry for myself or, you know, wallow in self-pity.
Guy tells me he was diagnosed with ADD, and I'm like, that explains all of it.
The instant I found out, it was denial at first. I told my doctor it was full of crap. Then when he said, well, let me tell you a little bit about you. And he said, just try not to say a word and listen. You have 100 things going on at once in your mind. You can't keep your mouth shut. You say things you regret seconds later. You're impulsive. And as I gradually started sinking in my seat lower and lower and thinking he's full of poop was no longer an argument I could hold water with. Once you find out you haven't, there's a lot of people you want to say you're sorry to.
You know, I felt relief that, you know, finally, you know, I got some answers as to what's going on with myself.
You know, he investigated himself and realized that I have all these symptoms, and as an adult.
Yeah.
Well, back in those days, we just a hyper, and he's hyper, and he's always on motion, you know, where it was just his personality, and that's how we just took it.
I first discovered Strattera through my doctor, Dr. Cottingham.
Strattera is for the treatment of ADHD. It was approved by the FDA for use in adults. I think for most patients, they get a response from the medication within the first week or two. But for some patients, it takes as long as 4 to 6 weeks to see the full results from Strattera.
Strattera did not work for me at first, right away. I found that I had waves of concentration initially. And so when I went back and discussed it with my doctor, we decided to change some things.
Treatment is really about managing the medications and getting the right medication for your particular patient.
My doctor did talk with me a little bit about side effects. She said that don't be surprised, but obviously let her know immediately, and we'll work with that.
The most common side effects are dry mouth, constipation, as well as an upset stomach, which is lessened when taken with food.
Strattera allowed me to make that first step. It was like getting a leg up. Like if you're drowning, it was like someone throwing me a life preserver. And so now that I'm not drowning anymore, now I can start to look at, okay, where's the shore?
It made me feel like not only was I accomplishing something, but that there was hope. When I went and saw him in 2 weeks, I said, you know, Doc, I don't know if it's me or if I'm imagining it, but I could swear this stuff's working.
We definitely saw changes.
It was more people around me started noticing differences in my behavior, and it was really good that it was, you know, a more subtle change. It wasn't just this overnight thing.
I see him in stressful situations, and I won't say he's calm like that, but he just doesn't get upset to that degree that he used to.
I think the moment I felt like, okay, this is really working is when I got back my first physiology exam. I remember walking up to the place where my test was posted and finding my 3-digit code to identify myself and thinking, oh my goodness, I hope that I pass. I just hope that I pass. Even if it's just a 67, I hope that I passed. And seeing an 87, I remember calling my parents and crying on the phone. I passed my physiology exam.
School is really going great for her. She really has a grasp on the material. She's able to memorize it better, and as a result, she's performing better on her tests.
I still have ADHD, it's still a challenge, but instead now I kind of know what I need to do. When I set out to do something, it's going to get started and it's going to get done.
I think I've got to know who Joe really, really is with him being on the medication. So definitely more moments of, I guess, falling in love with him again.
Hello, you're on the air with Guy Kemp.
You're not going to have that urge that things jump out of your chest, and so you're going to get fired from the job, or you're going to say something to the boss.
Now he's just a lot more gentle. He's just a gentler, kinder, sweeter man.
I have had some validation moments, as a first year you shadow a doctor. And I remember going and seeing one particular patient who had just had a baby, and she wanted to know if it was okay if the baby didn't burp all the time after she fed the baby. And I was like, well, as long as the baby's not having any GI, gastrointestinal problems, but before I, put the final stamp on that, we'll ask the doctor that I'm working with. And we asked him, and he verbatim what I had just said, he told her, and I was like, man, I could do this. It's like I got it.
Joe is so in tune with Jack. They're very in sync with each other. They're great together. He's gonna grow up with his dad, and they're just gonna have this very special relationship together. I love seeing them together.
I think I see graduation day as being a day of confirmation that yes, I am a Dr. Smith. That means the world, and that's important to me.
We have plans, to bring Jack a little brother or sister soon.
Not that
too
soon,
but soon enough,
This is who I am, because this is who I always wanted and longed to be. And now it's making it easier for me to be me.
I just want to say I'm very proud of him. Very, very proud of him.
Thank you.
Every day, very proud of him.
You should not take Strattera at the same time or within 2 weeks of taking an MAOI, or if you have narrow-angle glaucoma. Tell your healthcare professional if you have a history of high or low blood pressure, increased heart rate, or any heart or blood vessel disease. Most adults in clinical studies who experienced side effects were not bothered enough to stop using Strattera. Common side effects may include constipation, dry mouth, nausea, decreased appetite, dizziness, problems sleeping, sexual side effects, problems urinating, and menstrual cramps. This is not a complete list of possible side effects. Contact your doctor or healthcare professional if you develop any unusual symptoms. Strattera has not been tested in geriatric patients. Full prescription information is enclosed in the patient information kit.